name is Debbie Frederick, and I am the Legislative Vice President for the Florida Nurse Practitioner Network. I'm also a practicing nurse practitioner in Bradenton, Florida, an assistant professor and director of the Family Nurse Practitioner Program at USF in Tampa. And we're here to announce our endorsement of Kim Kendall for the House in District 17.
Kim Kendall is a policymaker. She seeks new ways to ensure access to primary care and use healthcare resources more effectively and efficiently. AANP is the voice of the nurse practitioners nationwide and in the state of Florida. And Kim Kendall is an advocate for Florida. Kim Kendall, she gets it. And that's the most important thing that we wanted to say, is that she understands the removal of the scope of practice barriers against the advanced practice nurse practitioner.
There are actually 5 schedules for controlled substances. Schedule 1 are things that no one can prescribe, like LSD, heroin, those type of medications. But Schedule 2 is actually medications like stimulants for ADD. I treat college students who have attention deficit disorder, and I cannot prescribe the medications to treat them. I have to rely on someone else to do that. There, Schedule 3 and 4 are actually medications like sleeping medication, anti-anxiety medications, and Schedule 5 are things like anti-cough type medications, antidiarrheals, that if we do not have access to prescribing these, we cannot take care of our patients fully.
Without having the ability to provide care to our full scope, we are not able to give the patients the full care that they need. And one of the reasons is a lot of these, besides prescriptive authority, are from laws that were made before 1976, when nurse practitioners were given autonomy to start working on practice. So they're outdated laws, and a lot of these outdated laws are actually, they're almost comical if you think about them. We can't prescribe home health care. Home health care is what we do as nurses.
And working in a place, MediMD, that has tons of Medicaid patients, a lot of self-pay patients, and we're frustrated when we have to ask outside help and we can't provide the care that we need.
I hope that they will give us some scope, some freedom to the scope of practice, because my colleagues, as well as many other nurse practitioners I know throughout the state, their hands are tied. They can't deliver to the minority, the people that need it the most, the care that even Mr. Obama is trying to provide. So we need our freedom for that. But hopefully with Ms. Kendall, we can have some good way to provide that scope of practice without constraints.
I'm here to talk to you about the economics of the matter. We simply cannot provide for those folks who need this sufficient care throughout their healthcare continuum. We're proud to serve more than 5,000 patients in St. Johns County, and as you've heard earlier, we already have another clinic that's closing who serves 11,000. The economics doesn't work without the past legislation. I'd like to thank Kim Kendall for taking this as an initiative, and we are excited to move forward.
I've seen the many, many years of frustration as we march to Tallahassee every year and get stopped as we try to make changes for the good of Florida, the good of healthcare. It's not about us, it's about our patients. I work as a nurse practitioner in a free clinic once a week since 1985 in Tampa. I see the needs of these people who have no health insurance and rely on the care of nurse practitioners. We need more nurse practitioners because we can provide that quality and affordable, if not free care to help people stop the suffering. Let me tell you a little bit about our history with our controlled substance bill. I know that's gotten a lot of publicity because if you ask a nurse practitioner what's the number one barrier to their practice right now, it's not being able to write for controlled substances. When 48 other states in the nation trust nurse practitioners, they trust their nurse practitioners that we're not going to be making those pain clinic mills that we hear about, the oxycodone express. We are not that problem. So Kim Kendall gets it, and we need someone like Kim Kendall in the House to take care of you and your access to health care. So here's Kim Kendall. Thank you.
18 years We're one of 2 states that don't allow our nurse practitioners to practice to their full extent of their training. It's as simple as that. So let's talk about numbers. And then this information comes from the Office of Program Policy Analysis and Government Accountability, and it also comes from Florida Tax Watch Government Savings Task Force from 2010 to present. They say the cost savings will be $7 million to $22 million in Medicaid alone, $770,000 to $2.2 million for the state employee health care insurance, and $339 million for across the state of Florida for health care in its entirety. $339 million, and that is annually. You know, what's the number one question we keep getting asked, especially in the light of Obamacare and in the light of our economy? How can we shave down the cost of Medicaid and maintain its services? $339 million, 48 other states do it. They're within their training. We have an enormous amount of backing between even the Institute of Medicine, the Senate, everybody else is saying this. It seems pretty simple to me. This is politics. There's no other reason why we can't do this. And unfortunately, it's affecting our pocketbooks. It's affecting accessibility. That is just completely unacceptable. It is a job of the legislators to stand up and be good stewards of our money. This is just appalling to me. For 18 years, this has been going on. So I've made it my personal mission to make sure that we start educating everybody about this issue. What we can do, we can start going online and start educating ourselves through the Florida Nurse Practitioners Network. You can go to it, www.fnpn.org. They will very soon be setting up a place where you can sign up to get some occasional news updates. And when they hit the legislative session, we can start calling and emailing our legislators, because it is our job to hold our elected officials accountable, and I'm going to ask those legislators to do their job. We ask that you send somebody to Tallahassee who will make sure and will not leave that committee room until this bill is properly heard.